The expansion of Toronto's Community Crisis Service was taken care of by City Council here at City Hall this morning. What was a 3-year pilot program for mental health calls to 911 and 211 in designated zones will now be throughout the entire city. The program is considered a community-based, non-police-led response for people experiencing mental health crisis or in need of wellness checks. In the first year, 78% of calls were transferred from 911, and they were successfully resolved, according to city staff, without police involvement. Instead, calling on specialized community organizations. Here's some of the discussion surrounding the program at City Hall today.
That we need a different response to people in mental health crisis. An appropriate response that is more caring, and that recognize that that recognize that police aren't the answer to every call. That people with a mental health crisis need trained workers to help them de-escalate and find the right kind of support. Tens of thousands of people each year will get the appropriate response if they're having a mental health crisis. They will get referrals to programs, they will get follow-up calls and visits, they will get the care they need.
Police right now have to go into all these situations that are really out of their control, and it's very dangerous for them, and they go in there armed too. So the alternative is bring in trained nurses, counselors, professionals that calm the situation down and give people that kind of service they need.
We know that the Toronto Auditor General had told us that 40% of the calls that have been sent to police services could have been redirected to an alternative service. Today we saw that in this report, 78% of calls were directed to the Toronto Community Crisis Response. That means we're freeing up our other emergency services to be responding in the ways that only they can.
Toronto's Community Crisis Service will now officially become the 4th emergency service in Toronto, in addition to Toronto Police, Fire, and paramedics. Mark Mcallister, City News.